Professor Burke's role as head of clinical governance at the GHA is to investigate any concerns where it's thought that clinical standards may not have been met. In his email dated the 20th of November 2020, he alleges a cabal of a dozen individuals have paralysed the management structure and prevented a number of safety and quality initiatives from being completed. He says they are directly or indirectly the root of many of the preventable harm and deaths investigated over the past 2 years. Furthermore, Professor Burke says the main weapons of these individuals are intimidation, coercion and bullying of staff into their submission to comply with their views. The Chief Minister said allegations of preventable deaths is serious as it implies either negligence or crime. He confirmed the government had spoken to Professor Burke following the November 2020 communiqué and other subsequent letters, but said they had yet to receive any evidence or names to substantiate his claims.
As far as the government is aware, there is not the slightest shred of evidence of that scandalous and frankly frivolously made allegation. When these allegations were first put to the government, they were put to me. And so I called Dr. Burke to address the whole cabinet within days of the allegation landing on my desk. So the whole cabinet understood that if there were anything which might suggest that there have been preventable deaths in Gibraltar, we immediately acted to deal with that issue. The whole cabinet was addressed by Dr. Burke. I asked Dr. Burke to give me and the cabinet not the names of those alleged to have been involved in bringing those deaths about, but the names of the persons who had deceased in those circumstances, so that the government could put to the coroner the names of those individuals and their deaths could be investigated. I have not yet been provided with a name. The responsible thing to do, faced with such an allegation, where the lives of Gibraltarians are alleged to have been lost in a preventable way, is to immediately seek to investigate them. And when the allegations are put repeatedly and the questions are put to try and elucidate further information, we have a responsibility to continue to seek to elucidate that information, which is what I and successive ministers for health who have been in receipt of these allegations have repeatedly been seeking to do.
Taking questions from the opposition benches, Fabian Picardo said a great deal of work on the issue of clinical governance has been done, which will see a new committee-style approach in future. On public debt, the Minister for Economic Development, Sir Joe Bossano, and his GST counterpart, Roy Clinton, had a rare moment of agreement that the gross debt figure of £697.7 million, as at the 1st of April this year, is the highest ever recorded.
I can say I agree that it's higher than it's been before, and I predict that it will be higher still because we all agreed in this House to borrow £500 million.
What we agreed was what the level borrowing headroom was, not that we should borrow £500 million. I think there's an important difference in interpretation.
And Minister for Health, Samantha Sacramento, confirmed that details of the Mental Health Action Plan will be announced very soon. Parliament was adjourned until Thursday afternoon at 3.